It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join Paul David and Kyle Benedict as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives in Yavapai County. And now here's today's Countywide.
Welcome to Countywide. I'm Kyle Benedict. Today we are talking tuberculosis. March is Tuberculosis Awareness Month, and so here to talk about all things tuberculosis and treatment, symptoms, what to look for, what exactly it is Yavapai County Community Health Services TB Control Nurse, and that is Sally Slater. Thank you for being in this morning.
Thank you.
So tuberculosis, I think a lot of people know the word, but maybe some people are shocked to hear that it's still an issue. So first off, what is tuberculosis?
Tuberculosis is most commonly known for its respiratory infections, spread by coughing, sneezing, talking, singing, anything that expels particles from your respiratory tract. It can make you, it's pretty contagious, it can make you pretty sick, and it basically, when it gets into your lungs, it can eat away the tissue in your lungs, causing cavities.
Wow. And, I think there's a lot, you think about the history, and you hear people coming out to this part of the country out west with tuberculosis. I don't know if it was the drier climate or what it was, but is it still a problem here in the United States?
It is still a problem in the United States. One of the biggest trends that we see is with our influx of immigrants from other countries where tuberculosis is endemic. They are coming out here, and then typically we see it more within the first 2 years of them living here, that this dormant germ becomes active and they become sick and contagious, and then they spread it to those around them.
Now, is it hard to detect, or does it come off as something else, or why do you think these people are just not sure that they have TB?
So tuberculosis can be misdiagnosed as pneumonia.
Okay.
You get fever and chills, coughing up blood. You can have weight loss. You can have night sweats are one of the main symptoms of it also. But in other countries, sometimes they go to the doctor and they think it's pneumonia, and so they treat for pneumonia and not tuberculosis. Again, that can happen here as well, having it misdiagnosed as pneumonia.
Now, in terms of testing, what does that consist of? How do you get tested for TB?
So the easiest test to do is a TB skin test. So you go into your doctor or the health department, they place a small amount of the purified protein derivative under the skin in your forearm. You come back 48 to 72 hours later and we read it. We measure it in millimeters, and based on your risk factors, you have a different threshold for how big it could be.
Okay, and now there's, as I understand, there's a TB disease, right? And then there's latent TB. What's the difference between those?
So latent tuberculosis is where the germ is laying dormant in your body. You're not sick, you're not contagious, you don't even know it's there unless you get tested for it. Active tuberculosis is when you develop those symptoms. The night sweats, fever, chills, coughing up blood, weight loss, stuff like that. And then you go in and you get tested to figure out why you're so sick. And with those symptoms to be clinically diagnosed, you have to have 3 or more of those for 3 or more weeks.
Okay.
And then we'll really start looking into tuberculosis.
So now, do you treat a patient with latent TB differently than you treat somebody with TB disease?
Yes.
Okay. What's the difference
For
there?
the most part, two of the same medications. But it can be for a shorter amount of time. So latent tuberculosis, we will offer treatment to anybody with latent tuberculosis as long as there are no serious interactions with medications that they're already taking. And that can be treated in as little as 12 months or as long as 9 months, depending on the regimen and your other medications. Active tuberculosis is a minimum of 6 months treatment we start on 4 different medications, 4 different antibiotics.
A minimum of 6 months?
Mm-hmm.
Wow.
And typically, if you have cavities in your lungs, we'll go for 9 months.
Okay, geez. And now, do these people have to be isolated during treatment?
They do have to be isolated until we determine that they're no longer infectious. And we do that through sending sputum cultures to the state.
Okay.
The state lab tests it and tells us if they're expelling the germ in there when they're talking.
Now, are there a lot of cases of tuberculosis just here in Arizona, or have you seen an increase in cases?
Since I took over the program a little over a year ago, I have seen an increase in active tuberculosis cases. definitely more than we've seen in the past decade. Now, in our county, we don't have nearly as much as other counties that are more densely populated, like Maricopa County.
Huh. And just because of not as many people in
We're more
a small
spread
area,
out. We're
right?
definitely more spread out.
Okay.
And I don't think we have quite the influx of immigrants as other counties do, as Maricopa County does, for instance.
Now, it seems like, you hear about these tuberculosis, or you think of like the flu. We had you in last year. We were here last year talking about the flu. And with that, people say you get vaccinated. That's how you prevent getting the flu. Is that the same with tuberculosis? Is there a vaccine for tuberculosis?
There is a vaccine, but it is not used in the United States because research has found that it's not effective. It is still given in other countries like Mexico and the Philippines. We often ask for that when we're taking a tuberculosis history before testing anybody, because it will interfere with the skin test and it can cause a false positive.
Oh, wow. Okay. Yeah, I mean, it seems like that's the first question is like, okay, can I get vaccinated for it?
Yeah. Well, not in the States. There is no vaccine for
because
it.
you hear about herd immunity, especially with the flu, and so that doesn't apply here.
Unfortunately, no.
Okay, so where do you see in the future, how do we deal with tuberculosis?
Well, what we're trying to do in Yavapai County now is really aggressively treat latent tuberculosis to prevent it from becoming active and getting more people sick.
Okay. Is it fairly common, latent tuberculosis?
It is.
Really?
Actually, we see quite a few people with latent tuberculosis, and you're at higher risk, if you work in the healthcare facility, because you're exposed to so many different things and you really don't know. Nurses in the hospital might have a patient one night and they don't know that patient might have tuberculosis. And so, it all depends on your risk, traveling to countries that are endemic with tuberculosis, working in the healthcare field, stuff like that. So
now, in terms of, you ran through some of the symptoms, but what I've noticed with a lot of these medical diseases or just being sick, they share common symptoms.
Everything looks like the flu.
So, right, exactly. So in terms of tuberculosis, what are some of the symptoms that are just, specific towards tuberculosis?
The night sweats are a big one.
Okay.
We notice that people with truly active tuberculosis are waking up in the middle of the night just drenched in sweat, having to change their clothes.
Oh.
So that's a really big one that is a red flag for us. And again, any of those symptoms lasting for more than 3 weeks, we really start to look into. If you have the flu or something like that, usually within a week you're over it, then you start to recover. But these are ongoing and they don't improve.
So it's just kind of the mixture of all those symptoms, and they just continue to. They just continue. So okay, and you mentioned before the show we were talking about the public health department in Cottonwood. Same. You guys changed buildings. Is that what you were saying? You want to explain that?
So public health is now in the building on 10 South 6th Street. You have where you go to vote, and then the building next to it is where WIC is housed.
Okay.
And that is the building that we're in. You would go in through the WIC entrance, which is across the street from Cottonwood Middle School.
Okay.
And the Community Health Center of Yavapai is still right across from Garrison Park, and that's where our primary care providers are.
Okay, so it's still the same general area and parking lot and all that
Same
stuff.
parking lot, just a different building.
Okay. I just I didn't mean to just throw that in there, but I thought about it. I made a note here, and I thought maybe we should let people know that there's changed buildings, right? Same basic location. But we're going to take a quick break. Again, talking tuberculosis with Yavapai County Community Health Services. For more information, yavapaihealth.com, and then a good phone number, 928-771-3134. This is Countywide. We'll be back in a couple minutes.
The Q102.9 plays all the hits.
Yo, what's going on? This is Drizzy Drake.
Ariana Grande.
Maroon 5.
This is Rihanna.
I'm Shawn Mendes.
Hey, it's Bruno Mars.
Ed Sheeran.
What's up, guys? It's Justin Bieber.
You're listening to The Weeknd.
Start your day with Brian James in the morning. You'll get at least 10 songs in a row during your ride home with Julie Page.
Zach Sang Show.
Catch the Zach Sang Show weeknights 7 to midnight. And Kelly Fox weekends on your home for hit music. The Q102.9 and 104.9 in Prescott and Cottonwood.
Hello, I'm Jen Cohen, host of Verde Valley TV's hit TV show, The Verde Valley Experience. On each episode, we feature local organizations, nonprofits, persons of interest, events, activities, and great local musicians. It's informative, it's entertaining, it's fun. It's the Verde Valley Experience.
time is the one thing that we want more of as a St. Jude parent. Without the donors, I wouldn't have my Audrey.
El que St. Jude no cobra ni un centavo para nosotros significa quitarnos todo ese estrés, esa preocupación y podernos enfocar en nuestra hija.
That was the first thing I was like, how are we gonna do this? When they told us that we didn't have to pay a single bill, I was like, wow. They pretty much have saved us.
They take care of our housing. They take care of our food. In addition to the best medical treatment that my daughter could ever have. So it allows me to focus on my daughter and getting her better.
Welcome back to Countywide. I'm Kyle Benedict, sitting down with the tuberculosis control nurse for Yavapai County Community Health Services, Sally Slater, and she was before break talking about what TB is, the symptoms, and kind of the difference between latent TB and TB disease, right? And so, for somebody who has latent tuberculosis, what makes that latent case turn active?
So as we, for instance, get older and our immune system starts to weaken, with that weakened immune system, our body is not as able to fight the infections that we once were when we were young and healthy. So that's a big one, is when our immune system is depressed. Also, high-dose steroids for an extended amount of time will suppress your immune system and can wake that up also. When certain people are being treated with biologic medication for rheumatoid arthritis, that suppresses your immune system as well and can definitely wake up that germ and cause it to become active.
So would you say the elderly is more susceptible to tuberculosis?
Definitely. Anybody with chronic health conditions that cause their immune system to not be as good as it should be. And then, as we get older and our immune system starts to shut down on us,
Yeah. So in terms of detecting it, if it's caught early on, is it easier to treat?
I wouldn't necessarily say easier to treat. Okay. Before the germ has a chance to actually cause cavities in your lungs, we can treat it in a shorter amount of time. But once those cavities start forming in your lung, it takes longer for us to treat it. So like I said, it can be anywhere from 6 to 9 months, in some cases a year.
Right. And you've mentioned a couple times cavities in the lungs. Is that something that'll heal after treatment is complete? And are there any long-lasting effects of tuberculosis?
Not typically, not that I've seen. The cavities in your lungs will definitely heal. And they may see scar tissue or scarring on your x-rays later on, but it will definitely heal. Okay.
So, as I mentioned at the beginning of the show, March is Tuberculosis Awareness Month, hence why we have Sally in here today talking about tuberculosis. What's taking place in order to get just kind of awareness out there, and what's going on with the health department during March?
So actually this month we implemented what we call TB Tuesday, and that's going to be something that is ongoing for the unforeseen future. So on Tuesdays, you can walk into any one of our 3 locations between about 8 and 4:30, 5 o'clock, and have your TB test done for school, for work, if your doctor wants you to have a TB test. And that you can schedule an appointment, or you can come in on a walk-in basis, and we're happy to see you do your TB testing. You just have to be able to come in 48 to 72 hours later to have that test read. There is a $40 fee without insurance. If you do have private insurance, we can bill that. We don't bill Access or Medicaid.
Okay.
Medicare.
Do you see a lot of people coming in and getting tested?
Absolutely. Especially with the college programs that we have here, the nursing programs, the EMT programs, anything like that. Any healthcare facility, you'll have to be tested, usually annually. Daycare facilities require their staff to be tested as well. So we get a lot of it for work and school related.
And you mentioned after you get tested, you have to come back 24 to 48 hours later.
Yeah, 48 to 72 hours. It has to be within that 24-hour window.
Okay, so mostly you're just drawing blood and just...
We're not drawing blood.
Oh, you're not
We
drawing
actually
blood, okay.
Inject a purified protein derivative under your forearm, and then we read it. Yeah, we read the reaction to it if you have one.
Huh. Okay. And so is that for somebody who has TB, is it easy to determine that?
Not always.
Okay.
But like I said, based on your risk factors, we have a different threshold that we have to read it at, and we look at your risk factors along with that in duration. And if there is a reaction to your test and you meet the criteria with certain risk factors, we will put it through what we call chest clinic. Which is where once a month our TB control doctor for the county reviews all of these charts, and that is where he will make his recommendations as to whether or not this person has latent tuberculosis, we need to offer treatment, or they're cleared and we don't have to worry about anything.
So if somebody has latent tuberculosis, how do you go about treating that when they have a family or they go home and they got kids and wife and all that? How do you, for somebody, I guess it's not active, but I mean, it could become active. How do you treat that?
With latent tuberculosis, like I said, we have 3 different regimens that we can use lasting anywhere from 12 weeks to 9 months. And you're not contagious. You're not putting anybody else at risk if you have latent tuberculosis. And so we do have people who have families and they actually opt to take the treatment for latent tuberculosis because down the line they don't want to become sick and get their family sick. And usually it's only one person in that family. We've had whole families tested, and it's just the one person who got exposed at some point.
Yeah. Do you see cases in children at all?
We have seen some cases in children, yeah.
Really? And the same symptoms and same treatment and everything like that? Okay. Yeah, I mean, that's one thing you talk about the elderly, right? I mean, the older you get, it seems like your body isn't as likely to fight off some of the things that it used to be able to, but children, same symptoms, same everything, and children can be tested the same exact way.
Right.
Okay.
And when we have to do a contact investigation for anybody with active tuberculosis, where we start with a small circle around them and test household members. And then if any of those household members convert to a positive, we kind of broaden that investigation just to see how far out this spread went. And we really focus on the high-risk populations, children under 5 years old. Those are HIV, immunocompromised, stuff like that.
Okay. Now, is it tested and kind of investigated the same way as the flu? Or do you do that with the flu?
We don't do contact investigations with the flu, no.
Okay. And I imagine, with the flu, you talk about with tuberculosis, the vaccine isn't very effective. So, but with the flu, of course, that's the message that everyone pushes out there is to get vaccinated. I guess with the flu, have you seen a lot of people coming in with cases of the flu this year?
I haven't seen much. We watch the state reports every week that they send us. Definitely, it looks like there's less than there was last year. Okay. But it is still ongoing. So.
Yeah, of course. It seems like, the flu, everybody can count on that every single year.
So. Oh, yeah.
Okay, well, we're going to take our second break. Again, talking tuberculosis. March is Awareness Month. And Sally Slater, she is the TB control nurse with Yavapai County Community Health Services. We're going to take another break and back in a couple minutes.
The Q102.9 plays all the hits.
Yo, what's going on? This is Drizzy Drake.
Ariana Grande.
Maroon 5.
This is Rihanna. Mateo.
I'm Shawn Mendes.
Hey, it's Bruno Mars.
Ed Sheeran.
What's up, guys? It's Justin Bieber.
You're listening to The Weeknd.
Start your day with Brian James in the morning. You'll get at least 10 songs in a row during your ride home with Julie Page.
Zach Sang Show.
Catch the Zach Sang Show weeknights 7 to midnight. And Kelly Fox weekends on your home for hit music. The Q102.9 and 104.9 in Prescott and Cottonwood.
Hello, I'm Jen Cohen, host of Verde Valley TV's hit TV show, The Verde Valley Experience. On each episode, we feature local organizations, nonprofits, persons of interest, events, activities, and great local musicians. It's informative, it's entertaining, it's fun. It's the Verde Valley Experience.
Time is the one thing that we want more of as a St. Jude parent. Without the donors, I wouldn't have my Audrey.
El que St. Jude no cobra ni un centavo para nosotros significa quitarnos todo ese estrés, esa preocupación y podernos enfocar en nuestra hija.
That was the first thing I was like, how are we gonna do this? When they told us that we didn't have to pay a single bill, I was like, wow. They pretty much have saved us.
They've taken care of our housing. They take care of our food. In addition to the best medical treatment that my daughter could ever have. So it allows me to focus on my daughter and getting her better.
Welcome back to Countywide. I'm Kyle Benedict. We're talking March as it is Tuberculosis Awareness Month. March right around the corner. And here from Yavapai County Community Health Services is Sally Slater, the TB control nurse, the only one in the county, right?
Yep.
So I guess if people want to go get tested, it's going to be kind of going through you?
Actually, our public health nurses do most of the testing for me. I kind of do behind the scenes after they've been tested, come up positive, and research our active cases.
Gotcha. Well, real quick before we go here, we only have a couple minutes left, but just to kind of recap, difference between latent TB and TB disease.
Latent TB is sleeping in your body. You're not sick. You're not contagious. When it becomes active is when you are contagious. You have symptoms like the fever, chills, night sweats, weight loss, cough, coughing up blood, shortness of breath, stuff like that.
Okay. And some people with latent TB might not even it might not become active.
Yeah,
right?
it can lie dormant for the rest of your life, or it can become activated when our immune systems are suppressed to the point where we can't.
But good to get tested, and just once it's there, you're going to treat it, right?
Yeah, we'll offer treatment to anybody with latent tuberculosis, and also if you don't have insurance, we will still treat you and not charge you for that. So.
Okay. And then you mentioned a new thing, TB Tuesday. Again, what is that?
TB Tuesday, you can walk in or make an appointment to get your TB test needed for school or work or your doctor's orders. And that's at any of our 3 locations, Cottonwood, Prescott, or Prescott Valley.
Okay, great. And then again, you guys have changed locations, or I guess changed locations, right?
A little bit, yeah. Across the parking lot, we're no longer in the 51 Brian Mickelson Parkway Community Health Center office. We're actually in the WIC building at 10 South 6th Street, across the street from the middle school.
And what was the reason for that? Just change of location?
Yeah, separation between public health and clinic.
Okay.
So now all of our public health in Cottonwood is in one building.
Okay. Well, it's nice you guys are still right there, though. Same area.
Right next to each other.
I imagine people might have to walk around a little bit, but they're just going to the same parking lot, right?
Yep.
And then you mentioned people can just walk in to get tested. We were talking about latent TB, TB disease, and just maybe now people are just going to want to know. I mean, I think the latent aspect of it, that it could be dormant in your body, is something that some people might want to get checked out just to kind of nip it in the butt there before it becomes active, right? And I imagine
because we can treat it to prevent it. So.
Okay. And you mentioned, again, is it easier to treat if it's latent and it's discovered as latent?
It's a less number of antibiotics, and it can be for a shorter amount of time.
Okay.
Yeah.
I guess the last question is, what's the worst case scenario with TB?
Worst case scenario is it goes completely untreated, and you will eventually die from it if it goes untreated.
Okay, so get tested, right?
Yeah, and treatment is mandatory for active tuberculosis. So.
Treatment is mandatory, and then as you mentioned, the vaccine. There is a vaccine, but it's
not effective and not offered in the United States.
And they use it in other countries, right? So nowhere in the United States.
Nowhere in the United States.
Really?
No, we do not vaccinate for tuberculosis.
Okay. So just the best way is to go in and get tested and then get treated from there if you do have it. So great. Sally, well, I appreciate you coming in. Thank you very much, especially tuberculosis. It's good to get the awareness out there with March being Tuberculosis Awareness Month. Again, TB Tuesdays. For more information, yavapaihealth.com. Again, a good phone number for more information, 928-771-3134. That's going to do it for today's Countywide. We'll see you next time.
Awesome.